Thank you very much for inviting me here today. I want to thank Laurie Martinelli from NAMI for extending the invitation, inviting me. But I also want to thank Bill Taylor, Executive Director for Advocates, Inc., who's with me today also, because without his support and without his collaborative partnership in the town of Framingham, there was a whole host of folks that we have helped along the way that wouldn't have received the help that we have by forming this collaborative effort. Approximately 10 years ago, I realized that we're not doing, as a profession, the policing profession, handling people with mental illness in the right way. We're criminalizing mental illness because we're arresting our way out of a situation where we're on the forefront. We're the first responders to folks that are maybe acting out of the social norms in the community. So there's two responses that police officers typically fall to when confronted with people that are mentally ill in the community that we are dealing with. One of those responses is a forced ride in an ambulance to a hospital for psychiatric evaluation. That's obviously an expensive alternative. The second one is an arrest, because an arrest is something that every police officer is very comfortable doing. We spend a lot of hours at police academies when we're young recruits learning how to do it effectively and appropriately. So it's something that every police officer coming out of academies is skilled with. But one thing that we're not skilled with is how to recognize, how to communicate, and what resources are available to deal with people that are mentally ill. And there's so much that we do as police officers that are out there on the streets at every hour of the night with no other resources available to us except for what we have been trained with. And so we fall back on our training. And what we typically fall back on are our handcuffs, because that's, again, what we're comfortable doing. We haven't been taught the skills to handle or deal with people that are mentally ill, or some of these complex social service problems that we so often face. There's only about 14% of a police officer's time that's committed to true law enforcement function, what we typically think of a law enforcement function, chasing bank robbers, arresting people. The rest of it is going to people's houses for domestics, or dealing with somebody out on a park bench that is off their medications and is acting inappropriately. So somebody's called 911 to have a police officer deal with that person. So the officer at the scene at 2 in the morning in any community that's represented here today and across the Commonwealth is really left to their own devices. And that training that they received in the academy is 4 hours on how to deal with the mentally ill. That's 4 hours out of 800 that we receive at the recruit level, with no mandate for a follow-up training. So I've been a police officer for 28 years, and I've only had very little training as a follow-up to that initial recruit training on how to respond to the mentally ill. That's why I chose to partner with the folks in my community, advocates, to handle folks that are mentally ill, because I knew we were doing it wrong. I knew our police officers were handling it wrong, and we were trying to arrest our way out of the situation. So, I commend NAMI for putting this paper and research together, and a lot of folks for their support, because as you heard Senator Keenan mention, that person down in the jail cell that's bloody, I've put that person in the jail cell many a times, on many a situations. Why? Because I didn't know what else to do with that person, because there's no other resources available to me to handle that person. So I'm either trying to convince that person to get into an ambulance to take them to the emergency room, or into the back of my police cruiser. And like I said, that is being played out across the Commonwealth at any given time in any given community. So there's definitely a need for police officer training at the recruit level in the academies, not an unfunded mandate. We need the financial support to go along with this, but the support in the police academies to receive the training on how to recognize, how to deal with, how to communicate, and what resources are available, and how to partner with folks that are specialists dealing with the mentally ill. And to do what we've done in Framingham, when we started our program, we brainstormed on what is our slogan going to be for our jail diversion program. And we decided on compassionate justice for the mentally ill. And that's what it's all about. It's compassionate justice for the mentally ill. It's not criminalizing them. It's not stuffing them in a jail cell that's reactive and not providing any sort of long-term treatment or benefit for them or the community. It's just taking them out of the community's eye for that moment, putting them in a cell, locking them away, hoping that someone else is going to deal with the problem. Well, we're the folks that are dealing with the problem day in and day out, and we need the right training and the right resources to help us do that. So that's what we're here for today, is sort of to appeal to that level. So thank you.